This is Minda Wilson for Urgent Care. I'm very excited today to welcome Ariana Long, Chief Operating Officer of the Patient Safety Movement, to my show, Urgent Care. Welcome, Ariana.
Minda, thanks so much for having me today.
So, what drew you to the Patient Safety Movement? How did you first become involved?
So, interestingly enough, I've not had a preventable death or a medical occur in my friend or family group, to my knowledge. And when I heard about this movement and was asked to join the team, I come to work every day because I'm terrified that there could be an opportunity where I'm going into the hospital or a friend or family member would go in, and we need to reduce preventable deaths. They're the third leading cause of death in the United States, killing more than 250,000 Americans every year. And so that could be me and that could be you. So that's really how I got involved, was ensuring that I come to work every day to make connections and help hospitals put in place processes so that I'm not that patient tomorrow and that you're not that patient tomorrow that ends up dying because of a preventable cause in the hospital.
And I don't think people realize that there's a lot they can do to make their hospitals stay safer.
Exactly. Yeah, you're so right.
So you have like checklists that you can provide to help people manage their care when they're in the hospital to be more safe.
Yeah. So what I would recommend for anyone in the public to do is, before you go into the hospital, maybe it's the closest one, maybe it's far away from you because it's a specialty hospital, make sure you go online and do your research. We all know that we have amazing doctors usually, that's why we're going into the hospitals. We trust that one person to take good care of us. But you have to remember that there's a whole team. There may be 10 to 20 people who will end up taking care of you if you go into the hospital. And so you should really ensure that whole team, that whole hospital has the good processes in place to ensure that you are safe. And so there are a few tools online where you can pop in your zip code and see the safety scores of those hospitals nearest you. The other thing that you can do is we've developed a free mobile application for Androids and for Apple iPhones, and you can go on and learn more about some common dangers and how to get more prepared. The mobile app is called Patient Aider, so kind of aiding a patient, Patient Aider, all one word. And we've developed this app by working with a nurse who was frustrated that her patients didn't have all the information that they might need. And so she helped curate the content and then donated it to the Patient Safety Movement Foundation, our organization, to help get the word out. So we now have it translated in Spanish, Chinese, and we're working on Arabic currently. So we're really trying to make sure that this is accessible to everyone out there to utilize.
So basically, the thing that's interesting to me is that a lot of things, when people go into the hospital, they're prepared for something to go wrong in surgery. They're prepared for something, something to go wrong in their treatment, but they're not really prepared for something preventable to go wrong.
Mm-hmm. Right, exactly.
And then once that happens, the best way to stop that from one of the issues that they have in hospital now is with people getting infections. Mm-hmm. And there are ways that you as a family member or a loved one for that patient can help them prevent that.
Exactly. So I think you bring up a really good point, Minda. There's a difference between a complication and a medical error. So just real quickly, a complication is something like maybe nausea or, a sore infection site, something that we know we might anticipate based on the type of surgery or the type of treatment that you're getting. What we're talking about is medical errors, which are issues occur in the hospital that were not anticipated, that should not happen. And so you brought up a really big one, which is infections. And so believe it or not, these days, infections are preventable. There is no reason anyone should be getting an infection in a hospital. And back in the day, they used to think it was part of doing business, but because of all of the innovations and technology and research that has been done, you shouldn't get an infection at in your incision. You shouldn't get an infection when you have a catheter placed. And so what we work to do is ensure that those hospitals have the best practices, the evidence in line to ensure that that won't happen to anyone else. But what you can do to help mitigate that is have an advocate with you. And that can be a friend or a family member. The thing that I like to try to kind of hone in on when someone might be picking someone who's going to be at their bedside is just try to be careful. If you have a loved one, a spouse, a brother or sister who's going to be with you, and they have a short fuse, they may not be the best person to be at your bedside. Maybe your neighbor who, you have dinner with once a week, who knows you really well, who can stay calm and collected and, take down notes and be a good middle person between you and the care team might actually be better than that short fused husband or wife that you have. And so I think that's really helpful information because you really want to be respectful of the team that's caring for you, but you also have to be really vigilant and ensure that any questions that you have or anything that seems slightly off, you can communicate effectively to the care team so they can help you and you can be a partner in your healthcare.
Sorry. So when you meet that person and that person is there, how can they be proactive? What can they do?
So there are a whole bunch of tools online. I would encourage you to go to the patientsafetymovement.org website. We have a whole ton of resources for patients and family members. So there are checklists that you mentioned, Minda, that your advocate could download. It's anything from just ensuring that the medications that you would be getting as a patient in the hospital, that someone else knows what those medications are, how frequently they're being given. That way, if the pharmacy gets behind and ends up giving you a dose 4 hours late, but then you have to get another dose, that they don't double dose you. That's a really big issue related to medication safety where, there can just be disconnects. And so by having someone by your bedside who says, I think that Ariana just got that dose about 20 minutes ago. Are you sure that we're supposed to get that again now? That can totally prevent mistakes from happening. And the team will be really appreciative of you being there to help catch those issues and errors. And so another way is to download all those checklists and ensure that at discharge, when you're actually leaving the hospital, a lot of times people get really excited and, aren't really listening to the directions that they need to take home with them. But if there are new medications or changes in the way that you're going to be moving around your home, kind of occupational therapy, that's really important for someone else to be with you and for you to understand what that care plan is going to look like after you go home.
Right. And one of the interesting things that happens oftentimes is they're given new medications and then they resume their old medications, which they didn't bring with them to the hospital. And there should be a discussion before they leave about what medications they should be taking.
Yeah, so Minda, that's called medication reconciliation. So it's reconciling all of those drugs that you may be on when you go into the hospital and then you go out of the hospital. So it's part of the care team in the hospital job when you're being discharged to go through that. And so if that doesn't come up in those discussions, please feel empowered to ask, okay, so can I resume all of the drugs that I was on before my stay with all of these? Are there any contraindications, which means are there any, are any of the drugs going to react with one another? That's a really essential way to ensure that when you go home, that you are going to be taking the right thing and not messing up anything and having to be readmitted soon after that.
Right. And the other thing is post-surgery, you may not be feeling your best. So that's where the advocate comes in as well.
Exactly.
by,
You might be foggy. You might, you might still be in pain. So having a second eye, a second ear to note down that information. And then when you're feeling your best, you can reach out to that person and just make sure that, that you're all on the same page. But, handoff communications is what they call it in the hospital, but it's that handoff of information between care provider to care provider and care provider to patient. It's really easy to miss a piece of information that can be key. And so this is where an advocate, again, can just be that second set of ears and eyes to catch those little things from falling through the cracks.
Right. And another issue that happens is in a relatively recent development is the use of hospitalists. So many doctors no longer have privileges in hospitals. So your doctor isn't seeing you when you're in the hospital. And the hospitalist doesn't always communicate well with your doctor once you go home.
You're so right, Minda. So hospitalists are, this new breed of doctor. And as you mentioned, a lot of doctors are not able, your primary care physician isn't able to go into the hospital to help you. And so one thing that you can do is ask your doctor next time you go in for your annual checkup or any other reason that you'd be seeing your doctor, and just ask, if I went into the hospital tomorrow, would you be able to intervene in my healthcare? And if they can't, that's a really important piece of information that, again, your advocate can help communicate between your primary care physician and the hospital where you are. I mean, sometimes you just don't have a choice. You get in a car accident and you go to the nearest hospital, and it can't be prevented there. But hospitals can be a really, if your primary care physician does have rights to your local hospital, and you know that you're going to be going in for some kind of operation, they can be a key player in ensuring your safety.
And the other thing that people need to be aware of, I think, is that the hospitalist acts as your doctor while you're there, and the surgeon usually does the procedure, may check up on the results of the procedure, but doesn't manage your overall care. So if you have multiple conditions, in addition to the one that you're having the surgery for, it's the hospitalist whose job it is to manage those conditions in conjunction with
I couldn't have said it better myself. That's exactly right, Minda. So the way that you've explained it is exactly right. You may have an anesthesiologist and a surgeon. Maybe you have a pulmonologist if you're going in for something related to your lungs. But that hospitalist is going to be the person who ties all of your care together. So really important to keep that person in mind as your greatest ally.
Right. And the other point that I want to make is, let's say you're a diabetic and you break your leg. The surgeon is only there to tend to your leg. The hospitalist tends to your diabetes. So what you need to do is sort of make sure that when you leave, the communication about what happened with your diabetes while you're in the hospital is given to your physician who's responsible for managing that care outside.
Exactly right. Perfect example.
So this is a really exciting movement because you're bringing a lot of hospitals to make commitments for zero preventable deaths. I mean, that's your goal.
Exactly.
So
yeah, and we really feel that by making these public commitments, sharing it through our network, which we're global, so we actually work with partners across 50 countries currently, we believe that by these institutions, your local hospital, making these public commitments, we believe that what is publicly or what is shared improves, but what is publicly shared improves faster, right? So when you have the public's eye on what you're doing, you're going to be a little bit more transparent and you're going to be a lot more accountable to what you've made commitments to. So that's what we urge hospitals across the country, across the U.S., as well as across the world, to share with us what you're doing to improve patient safety. Even if it seems like it's, what the hospital next door is doing, there's a lot of innovation. And so we want want that to be easily accessible. And so even as a layperson, someone who isn't working in the hospital space or in the healthcare space, you can go on and see what hospitals in your local area, or interestingly across the world, you can see what they've committed to, what they are planning to do inside of their hospital to ensure that you're safe. And so it's a great resource if you, again, do some research before you pick a hospital or before you go in. You can do research on what has the best safety score, which hospitals have the best safety score, and then you can also cross-check and see exactly what they're doing through the Patient Safety Movement website.
And does that apply to the physicians as well, or is it just focused on hospitals?
We're just focused on hospitals. That's where we have the best data, where we can track how close that we're getting to zero preventable deaths. It's still not a science, unfortunately. So, we say that about 250,000 Americans are dying in hospitals, which is the third leading cause of death behind heart disease and cancer. However, because it's not noted in death certificates and it's not tracked through one central system, since we don't have a national health service or anything like that, it is an estimate. So it's the best that we can do, and that's why we picked the hospital space to start off with, because a lot of the data outside of the hospital in primary care or even in nursing homes is a lot harder for us to pull.
So if you have a loved one in the hospital, we've identified two critical issues: the medication reconciliation and cleanliness. In order to make sure people are washing their hands when they touch the patient, or make sure the room is clean. And what else should they be looking for to see that's done while they're sitting there with their loved one?
Yeah, so we have a list of 18 overarching challenges that hospitals are facing related to patient safety. What you've mentioned around ensuring that providers are coming into your room and washing their hands is essential to prevent infections. And medication safety is also really important. The other thing that I'd like to drive home is patients and family members being engaged in the care. There is still a handful, bigger than I'd like that handful to be, of providers that are not engaging patients and family members as a true equal partner in that care. There's a really great movement to help facilitate that, and payment systems in place to incentivize hospitals to do more of that. But I would really encourage you to view those providers during your care as an equal and tell them, I want to be engaged. I want to help. Please involve me. And I would say, a majority of the providers are going to say, yes, we want to help you. You might get some pushback from those people who haven't caught on to that fire quite yet. But that's the biggest thing that I can help push right now, is that you as a patient or you as an advocate really do have the right to have access to information about what's going on with you. And there's this old saying that says, trust me, I'm a doctor. And I would take that lightly. You should trust doctors and nurses and all of the other providers around those clinical pieces that they have gone to school for. However, you as a patient, knowing yourself, or you as an advocate, advocating for your loved one, you truly do know more about that person than any provider who is just learning, about that person. And so, please just be encouraged and empowered to speak up and say, mom can normally do the Sunday crosswords, and she's really having trouble with it. This is really unlike her. What's going on? How can we look into, why mom's confused after surgery? And so, just speak up and be respectful at the same time, to ensure that they know that you're there to be another piece of the puzzle to help connect all the care together.
So what you're saying is you have the right to know and to understand what's going on.
Exactly. You should be able to, I know they move around, especially in the hospital. They come into the room and they do something real quick and they leave. You have the right to ask questions. You have the right to understand exactly what it is. Why are you giving that medication now? What's it for? That information is going to be really helpful. Again, if someone comes in and says, oh, I'm going to give another antidiuretic. What's an antidiuretic? Why are you getting it? Why are you getting it twice a day? That you have the right to understand. And so it's a really big piece that I think a lot of people in the past have been afraid to speak up. They just say, these providers have been trained for far longer than I have. I don't really know what's going on. You should know. You should absolutely understand what medications you're getting, what the treatment looks like, what the potential complications might be, and how to deal with those when you get home.
And if the person you're dealing with won't explain it to you, you have the right to go up the chain. There are people in the hospital whose job it is to work with patients who aren't understanding, to help bridge the communication gap with the people who are providing them services, and they're there for you to call.
Exactly. So those people are sometimes called patient advocates. They are sometimes called ombudsmen. And you can also ask for the patient safety department. If you had any patient safety concerns, most hospitals these days have a patient safety officer or a director of patient safety. If they don't have that, I would encourage you to ask for risk management. So they're managing the risk of patients and in the hospital. So those are some kind of key words to keep in mind if you do run into trouble. But you absolutely shouldn't ever feel like you're lost. And there are a lot of new tools through the internet that you should Google if you get into trouble. Just remember that word, patient advocate, because most people don't realize until it's kind of too late that they might need help. And so just remember, patient advocates can be friends and family members, but they can also be professional. They can be found through the internet, and they can come to help you at the hospital.
And there's a way people can join the patient safety movement.
Yes. So you as just someone in the community, we'd love for you to be part of this patient safety movement. If you've been affected by a medical error in some way, shape, or form, either yourself personally through an injury or a family member, we'd love to hear your story. We want to continue to motivate providers out there that this is still happening and they have to do more so that we can get closer to zero. Another way to get involved that I'm really excited to share is we are looking to do a march on patient safety. So kind of like the Women's March or a climate march, we want to march to make sure that people understand that this is the third leading cause of death in America, killing more people than car accidents. It just comes underneath heart disease and cancer. And so this is a really silent killer that a lot of people don't know about. And about 1 in 5 Americans, based on a survey that was recently done, recognize this once you start talking to them about it. They will say, oh, my neighbor had an infection in the hospital and they passed away. So it really is something that's touching all of us and could touch us in the future. So if you'd like to get involved and learn how you can become more involved in the patient safety movement, please go to patientsafetymovement.org. We'd love to connect with you and see what you can do in your local community.
And there are people that are community advocates as well.
Exactly right. So we can put you in touch with based on a topic or just based on your geography, and help you get connected to advocates near you.
So if you want someone who's going into the hospital to have one key point that they go in with from the patient safety movement, what would it be? One key thing to remember.
Speak up. Speak up. Speak up for your safety. Speak up for your loved one. Speak up for everyone else out here who needs to move patient safety forward. You have a voice. You're empowered to be a partner in your healthcare. So speak up. Speak up if you see someone not washing their hands and they're approaching you. Speak up if you think that you see something that could put yourself or a loved one or someone else in danger. If you see a puddle on the floor and it's a fall risk, speak up. Speak up if you are not being treated as a partner in your healthcare. Speak up.
And if they see that a hospital is hiding errors or their own errors, is there a way they can, or something they personally experience, is there a way they can reach out to you?
Yeah, feel free to reach out to us. You can go to patientsafetymovement.org and fill out the contact page. We'd be happy to point you in those directions. If it does get that far down where the hospital is not being responsive, you can go through your local state health department and make a formal complaint. I would encourage people to, again, speak up if something goes wrong, because even though it may be too late for you, it may help someone else if that hospital continually gets, infraction over infraction. They're going to have some repercussions to that. And so please just remember that you have a voice, and that can really make a difference to someone later.
And if you have a safety concern or you have a loved one that's going into the hospital, make sure you check out their website. Their checklists are amazing, and the information could help save the life of someone you love. Ariana, it's been a really great pleasure having you on our show. I hope you'll come back. Ariana, the COO of the Patient Safety Movement. This is Minda Wilson for Urgent Care.